A major step in HIV prevention after the Ministry of Health, through the Pharmacy and Poisons Board, recommended the registration of Lenacapavir, a long-acting HIV prevention drug. The medication, available as tablets and a twice-yearly injection, is being hailed as a game-changer in reducing new HIV infections. Elizabeth Atieno reports on what this means for the country's HIV response.
A cloud of hope hangs over the 1.3 million Kenyans living with HIV after the Ministry of Health today announced that Kenya will soon roll out Lenacapavir, a long-acting injectable drug administered twice a year to prevent HIV infection. In a statement sent to newsrooms, the Ministry of Health says this recommendation follows a comprehensive scientific assessment of the quality, safety and efficacy of Lenacapavir, conducted in line with Kenyan law and applicable international regulatory standards. Kenya is among the first African countries to recommend Lenacapavir for registration, a decision that aligns with recent global public health guidance, including recommendations by the World Health Organization. African countries that have already granted formal regulatory approval of Lenacapavir include South Africa, Zimbabwe, Zambia, Malawi, Botswana, Rwanda, Tanzania, and Uganda. The injectable Lenacapavir offers an important alternative to daily oral HIV prevention medicines. This is particularly beneficial for individuals who face challenges with taking pills every day. The Ministry of Health says they will ensure the medicine is introduced in a timely, equitable and responsible manner for populations at substantial risk of HIV infection. In September 2025, UNITAID and the Clinton Health Access Initiative (CHAI) signed a partnership aimed at reducing the price of injectable Lenacapavir from 3.6 million Kenya shillings to 5,000 Kenya shillings per person per year in 120 low and middle income countries, including Kenya, by the year 2027.
The generic versions will be available in low and middle income countries just 1 year after Lenacapavir hits the market. For the first time, we have a real shot at moving from managing HIV/AIDS to actually ending it.
We invested 50 million to shape and introduce the market together with CHAI.
The Lenacapavir prevention regimen also includes an initial oral dosage, 2 tablets on the day of the first injection, followed by 2 more tablets the next day to achieve effective drug levels quickly. As part of the global pricing agreement, the oral tablets will cost no more than 2,000 Kenya shillings per patient. Lenacapavir was originally developed by Gilead Sciences and has since demonstrated exceptional effectiveness in HIV prevention. It was approved by the World Health Organization in July 2025.
Lenacapavir is truly a revolutionary shot, nearly 100% effective at preventing HIV infections.
Kenya has been witnessing a sharp increase in HIV and AIDS cases, with more than 20,000 new HIV infections reported in 2025, a situation worsened by dwindling donor support. Experts warn that this trend could lead to 6 million additional HIV cases and more than 4 million additional deaths globally. Elizabeth Atieno, TV 47, Nairobi.